measuring now that we've marked all of these observations down. We're going to be measuring with the scoliometer for the rotations and marking that with some little stickers, and you can just buy these at any store or office supply. We're going to be using our scoliometer. So the best way for you to perform your scoliometer is for you to be sitting behind your client. So I'm going to have you back up just a little tiny bit so you don't hit your head. Good. Hands are going to be together. Come forward just a little bit, I lied. Yep. And your feet are going to be hip distance apart and straight. Shoes are off. Hands are together. That's so we don't get any uneven measurements. And bend down with legs and arms staying straight and completely relaxed with your head. So I'm going to be directly behind her to do the scoliometer measurement. I want to make sure I'm using two hands and not pushing, but make sure your leggies are straight, but keeping even pressure on the scoliometer. Sometimes it's easier to pull the scoliometer down than pushing it up. Whatever technique works for you, I do it a number of times to get the best accurate measurement. And when I see the biggest number, that's where I will pause and place my sticker and mark that number on our chart. So we have a prominence right there on the lumbar spine, and then I will move this further up, having the client bend further or come up a bit depending on your angle of view until we find another prominence. And wherever that might be, we're going to put a little sticker there as well. Don't forget to take your scoliometer all the way up to the top, because there might be a counter curve at the top. You want to make sure that you're capturing those rotations as well if you see them. Go ahead and come back up to standing. And now we can see this is where our prominences are, and you want to calculate that against your x-ray. All right, next, let's look from the side. So if we turn, go ahead and just turn this way. Perfect. Yep, and then we want to notice if there's any extreme lumbar curve or flattening, extreme kyphosis or flattening. And then notice that that will look very different from this side, which is the lumbar side, than it will from this side. You'll see more thoracic side and a flatter lumbar side. So looking at the side view will be very different right to left. So you want to make sure that you look maybe from both sides. So turning back this direction, we now have a good, accurate visual of everything that's happening, and you have marked it down. And it would be amazing to also take a snapshot with your camera and mark the date so that you have all of that recorded as it changes over time. Okay, very nice. All done and assessed.